welcome Dr. Dennis Culhane, an architect expert on homelessness and assisted housing policy, regularly quoted in the New York Times, an advisor to the Federal Department of Housing and Urban Development, and the Dana and Andrew Stone Chair in Social Policy at the University of Pennsylvania.
Can I move it up a little bit so I can see the screen?
Sure.
Thank you.
Want to go all the way up?
Yeah. All right. I just had to move this a little bit so I could see the screen. Good afternoon. Thank you for inviting me to be here. This is now something totally different because I'm not going to talk about the migrant crisis, and I know that has been the focus. But when Daniel asked me a few months ago if I would do this presentation, he never mentioned that it should be on the migrant crisis. But also, I am not an expert on homelessness and the migration crisis, so I don't feel that I could reasonably speak to it and responsibly as I could. I'm a little familiar with, and I've looked at the migrant issues in Europe, where these have been going on pretty much for much longer, especially since the Syrian crisis, but we could always talk about that. Instead, what I thought I would do is talk about just some overall larger trends, not specific to New York City, so some of this is going to not necessarily all apply to New York City, and I'll try to point that out. But just to give you a sense of what some of the other conversations are that are going on, which is why I mentioned the word about narratives. I think the predominant narrative that's going on around homelessness in the U.S. is about the unsheltered homelessness crisis, which is particular on the West Coast, but also beyond there. And then the ensuing encampment issues that have arisen as a result of that. Of course, we're going to have the Supreme Court case that's going to bring a lot of attention to that as well. And then, of course, the impact of the migrant crisis, which I'm not going to focus on so much. But in terms of the unsheltered homelessness crisis, if you haven't seen this map, this is something that comes from the annual Homelessness Assessment Report. That's that federal report that HUD delivers to the Congress every year. And this is from not last year. I'm going to actually not talk about the most recent report. I'm going to mention why. But before the migrant crisis really showed up, you can see how much the unsheltered problem is focused on the West Coast and Southwest. And there have been, despite that, I want to also say one of the narratives that's missing has been how successful we've been in reducing homelessness in the United States. Steve mentioned it in his remarks I saw, but I'm going to talk about it a little more. But what you can see here as well is that the trend line on the top is the total population. Homelessness dropped by about 100,000 people, point in time, between 2007 and 2016. It has gone up a little bit since then, which when you consider the explosion in unsheltered homelessness on the West Coast since 2014, the fact that it has only gone up 1 or 2% a year over those last 5 years, not counting the last year with the migrant crisis issue, is kind of remarkable. It means that homelessness has continued to decline in many other parts of the country, offsetting those big increases in California and elsewhere. So I'm going to just point that out. But what's really behind this, of course, there's a couple phenomenon, but one is the growth in chronic homelessness. Okay, the green line is the summary of unsheltered and sheltered here, but what you can see is, we reduced chronic homelessness by almost 50,000 people between 2007 and 2015, but now we have reversed course on that, and we have more more chronically homeless people than we've ever recorded before. And now we do know that because the chronic homeless initiative started here in the Bush administration, that it was probably about 150,000 when that started. But nonetheless, it's clear that we've reversed course in terms of the progress on the issue of chronic homelessness. This is also showing the increase among the non-chronically homeless, but also unsheltered. So this green line here shows that even among the unsheltered population, and even in fact in more of the unsheltered population is actually not chronically homeless, but that's also been going way up. Again, the focus there being the impact of the unsheltered population, particularly on the West Coast. The primary evidence, there's been a number of studies that have come out over the last several years that have pretty conclusively shown the statistical association between homelessness and rents. This particular study was done in Zillow and by the company Zillow, and I worked with them on the project. What I like about this as well is that it really signals out those 8 communities where the homelessness problem has spiked the most. So what you see here is a 3D graph. It shows you the poverty rate as you go here. It's the affordability threshold here, and then the rate of homelessness over here. And you see that there's a group of 8 communities in this very corner up here. They're all on the West Coast, except for it includes New York City and Washington, D.C. And those 8 cities have collectively accounted for most of the growth in homelessness since 2014, while in the rest of the country it hasn't. But really what's also notable is the affordability threshold. Once the average renter is paying more than 35% of their income on rent, the rate of acceleration goes way, way up, okay? So pretty clear, compelling evidence about the relationship to housing. It's not news to the people in this room, but there are a lot of skeptics out there who don't believe it, so I'm just showing we have some very good statistical information. This is just the national view on that expected homelessness rate, and the red is those clusters. Colorado shows up like this because they have one continuum of care primarily for the state that includes Denver, so it looks that way. You can't, the zoom is not good enough on this map to see New York and DC, but in the paper itself we have it there. But just again, show you that. So one of the questions I find fascinating has been why is there such a huge unsheltered homelessness problem on the West Coast and in the South, in Southwest and South? And you know, a lot of people say, well, it's because of the weather. You know, and I'm always puzzled by like exactly how does that explain? Does that mean that the nonprofit sector doesn't care as much about people who are homeless in California because they think it's warm enough? That doesn't make sense. Are people actually migrating there because of the weather? I don't know many people that move to Seattle because of the weather, right? Okay. And do you want to live in outdoor air pollution in Los Angeles? Is that really what people are trying to attain? So I'm a skeptic of that explanation. I'm much more persuaded from a book that came out in 2012 by Sybil Fox called 3 Worlds of Relief. And she went back into the data in the United States, and she used a data set from 1929, right as the Great Depression was happening, and she inventoried at a county level across the United States what forms of relief, poverty relief, did they have? Cash assistance, poor houses, almshouses, shelter-type arrangements, okay? And what she said is there are really 3 social welfare systems in America as of 1929, okay? The Northeast and the Midwest, where we are now. This is the place where the Industrial Revolution had just happened. It generated a lot of wealth. There was also a lot of philanthropy that came along as well. You had unions dominant in this industrial area as well. White European heritage Christians perceived that they were helping migrants coming to America who were also white European Christians, okay? And so this led to an expansion of public and private relief efforts which were available in 1929. In the Deep South, it's an agricultural economy. There was a sharecropping economy. The political order was maintained around this Jim Crow, essentially terrorism that existed. There was no support for public relief. Instead, they wanted to be able to exploit black people working for low wages, okay? So there was no poverty, and it was a seasonal economy. You didn't want to give people an alternative to having to work for very low wages on those farms. And in the Southwest and West, it was also an agricultural economy, migrant laborers. There was no support for public relief to induce the migrant workers, primarily from Mexico, to return to Mexico in the off-season, okay? So you fast forward 60 years, we come to a homelessness crisis in the United States. You could get on the phone, I was in this room in Philadelphia, you could get on the phone and get the 6 homeless providers in that community to get in a room by the end of the day and plan to double or triple your shelter capacity over the next 2 years, okay? But if you're in a community from these other areas, there weren't those providers. Maybe there's a Salvation Army and a gospel mission. There was not the infrastructure that you have here in this room, okay? Even today, you couldn't get providers of this size to gather in many of those areas, okay? So this is the historical legacy. Then to compound it, for the first 10 years, roughly, of the McKinney Act, the first federal money for homelessness, The money was awarded to people who could apply for it at a provider level, not the continuum of care, at a provider level. Well, where were the providers? They were in Massachusetts and in New York, Pennsylvania, and in the Midwest, and they won almost all the money that came out for the first 10 years, building further their capacity. Meanwhile, all these other places didn't have applicants, couldn't find the money, so they lost ground. So when the housing crisis becomes so acute on the West Coast, they don't have the infrastructure that exists out here. That's my argument for why we have the unsheltered problem on the West Coast, but just to keep it in mind, not that we can go back and fix that. All right. Oh, and by the way, we did recently do a study where, I was just talking about it here, we actually statistically modeled that, and a little more than half of the variability of unsheltered homelessness associated with temperature disappears. It's accounted for by these historic factors from 1929. So it's not just conjecture. All right, 2009 turns out was a pretty important year for homeless policy. Something that a great legacy of Steve's work over the years and the folks at the National Alliance to End Homelessness. These are three big things that happened. First, there was the American Recovery and Reinvestment Act to try to save the economy from the collapse that had occurred during the Great Recession. And within that was a program created, Homelessness Prevention and Rapid Rehousing, HPRP, $1.5 billion. It was the first time that we had a national program that funded homelessness prevention and getting people out of homelessness other than PSH. Okay, it was the first time. It was really important because it sort of proved to people that we could take on this issue, not just with chronic homelessness, but with homelessness in general, and we could provide some housing assistance. The second big one was the Hearth Act, which renewed the McKinney Act, and it makes Housing First the national policy, okay? And it created a new rapid rehousing program within the ESG program, which didn't exist. And it did deprioritize transitional housing because the research on transitional housing was expensive and the outcomes weren't good, okay? And then lastly, the Obama Homeless Veterans Initiative was launched, and that ultimately led to a $1.6 billion annual spend on veteran homelessness that continues to this day, including by 2015, 90,000 VASH units, supported housing for veterans, and $350 million annually just to do HPRP-like activities, okay? So this was all pretty big and represented, I think, the field sort of moving into a direction. And take a look at what happened to the inventory. If you look in the AHAR, you can see that the number one thing that's growing is PSH. It's almost up to 400,000 units. This gray line, once we hit to 2009, here's we are at 2009, and then everything goes in these directions. PSH goes up. Emergency shelter and transitional housing go in opposite directions because a lot of transitional housing programs recategorize themselves as shelters, and because the federal government's no longer investing in it, you see transitional housing going down, shelter going up, and then you see the rapid rehousing programs here going up, okay? So what's the net result of that? Three different groups just showing you the impact. So among families with children, from 2010, there's a 35% decline in family homelessness. We have a 50% decline in veteran homelessness, and we have a 25% decline in youth homelessness. No one's really been out there proclaiming the success of these efforts, but the fact is we have this evidence despite what was happening on the West Coast since 2014. This is kind of even remarkable when you think about it in that way, okay? So just pointing that out. But we still have major challenges that are to the homeless response system. Let's start there. First of all, when you think about homeless housing assistance, permanent supportive housing, and rapid rehousing, those are the two main programs we have to exit people from homelessness. They are not scaled, and this was mentioned by Steve as well. My estimate is that it reaches somewhere between 10 and 20% of the eligible population, depending on the community you're in. Reaches more people here in New York because you have FEPS and you have these housing resources that don't exist in most other parts of the country. But on a national basis, we're barely hitting 20% and 15% in most communities. So we have a lot of folks, of course, who means they're underserved. Emergency shelter itself is not scaled, okay? More than half of the adult population is literally unsheltered in the United States. That has been creeping up, and in 2018, finally basically flipped, and we have more unsheltered than sheltered, okay? 90% of families are sheltered, but only a little less than 50% of the adults. It costs about $28,000 per shelter bed, by the way, based on a study we did in 2018, okay? That's so roughly probably $30,000 today, annual cost per bed. It would take $5 billion to close the unsheltered gap with even the most basic, lowest cost form of shelter, okay, based on our estimate. We spend about $10 billion already on shelter annually in the United States. Think about that in contrast to what it would cost to close the affordability gap by making everyone who's eligible, very low income, for a housing voucher to get one. That would be estimated to be $30 billion, according to Beth Shin and Jill Kaduri in their book, okay? And I just also want to note, other than New York, where it's actually not statutory, it's a legal agreement that's in place, there is no obligation on the part of state or local governments to respond to homelessness. If you declare that you're homeless in any of these communities, they actually have no formal obligation to help you out. They don't have to give you cash, they don't have to give you shelter, they don't have to give you services, unless, of course, you can dial 911 and they will send EMT and you might get to an emergency room. That's the safety net that we have for people who are homeless. There's just no obligation to respond. Instead, we have fragmented charities, many of them weak nonprofit organizations with untrained staff, very low paid, and most shelters provide few services. Case management caseloads can be like 100 to 1, okay? Now, I'm not talking about New York. You guys are much better funded than everybody else. But around the country, this is what prevails, okay? It's a different environment. So the West Coast homelessness, the unsheltered crisis, I think is, by revealing weaknesses, is also pointing us in a different direction from what we should be doing, okay? I don't believe, as much as I'm very grateful and proud of the work that people like at the Alliance have done, that have turned those numbers in that direction, I don't believe that we're going to get there fast enough and far enough with incremental increases in the McKinney-Vento budget, okay? Homeless assistance and emergency shelter are not likely to be scalable anytime soon to meet that need, okay? I think we have to acknowledge that, and we have to ask, what does that mean? My sort of thing I'm harping on these days is safety net repair, okay? Especially for older adults and people with disabilities. Depending on how you define older, okay, 60 to 70% of the adult homeless population is either older adults or they're disabled, okay? We have programs in this country that were designed specifically to prevent disabled people and elderly people from being destitute. We created the Medicaid program in 1965 to make sure they had health care if they weren't eligible for Medicare, and we created the SSI program to make sure they had an income, mostly to be able to contribute towards rent, okay? That was created in 1972. It's clear that those programs are not working if 60 to 70% of the people who are homeless are either elderly or disabled, okay? That is a clear failure on our part, and we have to do something about it. So, by the way, SSI, we know enrollment is very low in the adult homeless population in general. It's very difficult to qualify. Eligibility rules are strict. They've got even stricter since welfare reform. And the payment level is 45% below the poverty level, okay? Imagine that. You're not just poor, you're 45% below poor, okay? You know, the primary reason for this is that it's indexed to the Consumer Price Index. And the Consumer Price Index is the overall measure of inflation. The housing component of inflation has gone up at a much higher rate than the Consumer Price Index, as the cost of clothes and food and other things have not risen nearly as fast as the cost of housing has, for example. So it has lost ground to inflation for the very purpose it was designed, which is mainly to pay for people's housing. Okay, so that's an issue I want to raise, and also that Medicaid is failing to serve this population. The great thing, the Affordable Care Act expanded the Medicaid rolls, brought in tens of millions of people into the program, and that's good. But two other things started to happen. One is mostly these big managed care companies, for-profit companies, have taken charge of the Medicaid resource, okay, from which they most definitely want to extract a profit, okay? And part of that profit is derived by serving as few people as you have to and the fewest services that you have to give them, okay? They have a financial incentive not to serve people, okay? And the only guarantee you have is the emergency room. And so what happens to people who are homeless, arguably the sickest, most needy people in our society who should be getting the priority for Medicaid, and no, they're picking up all of the Medicaid per member per month money from all of the other populations, and they've taken their eye off the mission of this program, which was to protect people with disabilities and old age from destitution, okay? All right, so I'm on my soapbox right here at the moment. But just look here as an example. I've only got 2 slides left. This example here, which is just showing you the rent levels. This is SSI, the blue and the red together. This is California. Okay, you can see what SSI is doing. And then you can see that suddenly in 2014, when the rents start to take off, it completely swamps the ability of SSI to be able to pay for that. And it completely corresponds to the huge growth in homelessness at that time. So just something also I think that supports that argument. So I would argue we need a few major reforms, okay? One is I would accelerate SSI eligibility. Screen people on the street if they are likely eligible. In the case of California, where I'm trying to promote this particular package of reforms, if you can screen someone as likely eligible, you start giving them $1,000 a month straight away. That's what the SSI is in California. Just give them $1,000 a month, enroll them in a program that's going to help get them to eligibility. But if you do so, 100% of the expenditure of that $1,000 it can be recovered from the federal government. So it's essentially a break-even program. So we should not have people who are disabled on the street who have zero income. We should be enrolling them in SSI immediately and getting them cash, okay? We could even also consider that we should have an emergency cash program for people who can prove that they're destitute, but like most homeless people could. There's no reason we should not have a national emergency cash program. No one should be eating out of garbage cans, et cetera, and all those things, and begging for nickels and dimes when we have all those resources. But getting SSI into people's hands is not enough because it doesn't match with rents. So I'm also arguing that whether it's the federal government or the state government trying to get California into this, or even local, like here in New York, there needs to be rental assistance to close the gap between what SSI has and what it would cost to afford some housing, okay? And I'm also strongly arguing for shared living situations. Yes, we have a housing supply problem. It's going to take a long time to solve the housing supply problem. People are going to die. Millions of people will die destitute before that problem is solved. We have a lot of units with empty rooms in them. Families have units. There are lots of empty spaces. You know, it's just unbelievable to walk around Los Angeles and to see all of these huge luxury condo towers, mostly empty, held by investors, foreign investors mostly, who don't really care about using it. They just want to hold on to it and then sell it. Even large corporations who now own 1/3 of the multifamily units in this country, right? Anyway, so shared living would mean you could live with this is like the HASA program. I think of New York City's HASA program as an example. You can live with the partner, you can live with the roommate, you can live with family members or friends, or in a boarding situation. The bottom line is you give people a housing allowance, I'm calling it a housing allowance guarantee. You got a letter in your pocket that says, you find a unit, we'll start sending them $800 a month, close to $10,000 a year, plus what you can contribute from your SSI, okay? Flexible, it incentivizes the person to go solve their own problem, not to have to wait for their case manager to solve it. It meets their preferences, and to me, administratively, it's the easiest and most elegant way to get lots of cash into people's hands to buy rents in the immediate term. Okay, leveraging Medicaid, we heard housing navigation, case management. Many states have now moved with their waivers They can do first, last month's rent security deposit. There's at least a half a dozen states that now can pay for 6 months of rent. So basically, you got your rapid rehousing package is fundable through Medicaid in a lot of places. But even though it's eligible, doesn't mean they have to do it. Okay, that's the real problem. Just because you're eligible doesn't mean I have to serve you. It's not an entitlement. It's discretionary. They have to do some slots, but they don't have to serve you. Again, it goes to that lack of statutory obligation. And I would say we could do more flexible rental assistance for families and young adults, but you guys do this in New York City already, so you're a fortunate place for rental assistance compared to most places. Should there be a guaranteed minimum income? We got a lot of experiments going on showing the effect of these guaranteed minimum income programs, how they're effective, to which I also always say, we have a guaranteed minimum income program. It's called SSI. Okay, so let's fix that one with as much energy as we're devoting to these experiments to see, isn't it helpful to give poor people money? Okay, so I'll stop there, and we can take some Q&A for a couple minutes, because I know we're due to adjourn to a break in a few minutes.
Hi, Jennifer Scholl, Disability Affairs at the Department of Social Services. I'm glad you brought up the disability issue here. So just as an addition to that, or a caveat to that, we do try and utilize Medicaid dollars, the nursing home transition and diversion waiver, all of that. But you still have to have a unit. And since a high percentage of these people have mobility disabilities, the housing crisis for people with mobility disabilities is way more than for your typical person, because you need first floor with accessible entrance or an elevator building, which is generally more expensive. So one of the priorities I think we need to have here, since you're talking about the high rates of people with disabilities, is finding out ways to ensure that all of our options prioritize for any of those available units people with disabilities, and not just give it to the next person on the list. And I will say that our own staff in shelters say it takes double the time for me to find an opportunity for that person, so I don't spend time on that person because it's so much easier to get everybody else out.
Right.
So it's a double whammy.
Thank you.
Hi. If you would go back one slide, I just wanted to know more about your proposed plans for the major reforms needed.
This one, yes.
Yeah, I just wanted to know where I could read more about that, and also if you could elaborate at all on the guaranteed minimum income, if you had visions for that plan, or...
I mentioned it because there are so many experiments going on all over the country with these guaranteed income programs, basic income programs sometimes called. So I raise it as a point also, though, to make the counterpoint. We have one, and it's not working, and we should make it work. Because the American people have already passed through their Congress the Medicaid Act and the SSI program. We don't have to create a new program. But where can you read about it? Send me an email. I'll send you. I have a little 3-pager I've written up on this. What I'm trying to do, I have been working under contract with the County of Los Angeles to sort of envision some of how we can implement this, packaging the money. The concern in California is that the state, which is spending almost $1.5 billion just on homelessness directly to the counties, it can't be used for rental assistance. Not legally. Legally it could be used for rental assistance, but because it's a 5-year program, no one's going to turn it into rents because they're concerned that they can't sustain people in the housing once they get it. So instead, all the money gets spent on homeless programs that are helping to sort of maintain people in homelessness. They're not actually going to direct rental assistance. That's a big problem. Look what New York accomplishes with direct rental assistance. There is no direct rental assistance program for people who are homeless in Los Angeles or in the state of California.
That's all we have time for.
Thank you.
Thank you, Dr.
Yeah. Thank you.